Joining me today is Dr. Isaac Kelly, urologist at Inland Urology Medical Group. Thank you so much for being with us today, Dr. Kelly.
Absolutely.
What does a healthy prostate look like?
It sits right around the base of the bladder. So when you urinate, your urine is going through the center of the prostate. And so as the prostate grows, which is natural over time, so as men age in their 20s and 30s, their prostate is fairly small. You get into your 40s, 50s, 60s, everyone's prostate is growing, and it's starting to block off that flow. So it makes the bladder have to work harder, which can make you pee more often. It can make you get up at night. You're dribbling. You're not hitting the back of the toilet like you used to. You're taking a long time in the bathroom, even leading to infections. Sometimes you can't urinate at all. It damages your kidneys. So there's all these kind of progressive things that happen as the prostate is growing and blocking things off more.
Are there things men can do to prevent the onset of prostate cancer?
So it's really that blood test, and it's a very simple blood test. It can be done with your annual physical with your primary care doctor. As I mentioned, there was some controversy about how useful it was. This was a few years ago, and so some primary care doctors are less comfortable with having that test done. And I would have that conversation with your primary care doctor, see what their thoughts are, see what they're explaining, because currently the current recommendations from the major guideline groups are to have a conversation and decide, okay, if I get this blood test, yes, it could lead to all these things, and maybe some of those tests won't be necessary, but am I okay with that? And most people, I think, end up saying, yes, a blood test is a reasonable place to start.
What's the best way to connect with Inland Urology Medical Group?
You can certainly, we have a website. You can reach us there. Our group, we're mostly in the western San Bernardino County and eastern LA County at San Antonio Hospital and Pomona Hospital are two hospitals that we work out of. And so that's the main patient population we serve is in that kind of region, although we do have patients who travel even from Arizona and Palm Springs to see us because of need in the high desert, things like that.
What's the phone number? So
our office phone is 909-985-9737.
Thank you so much for being with us today, Dr. Kelly.
Absolutely. It was a pleasure.
Latino Voices is produced by KVCR Public Media and is funded by generous support from San Antonio Regional Hospital. Here for life. For KVCR News, I'm Yvette Walker.